Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about a review of therapies and lifestyle changes for diabetes. So, if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon, or give thumbs up so that I will come up with more and more videos with lots and lots of information. So, here we begin. Let's go. Type 1 diabetes is an autoimmune disease that develops when the body destroys a cell in the pancreas that produces insulin. This means that people with type 1 diabetes do not make insulin. Without insulin, the body cannot regulate the amount of glucose in the blood. People with type 2 diabetes develop a decreased sensitivity to insulin, which means the body does not make or use as much insulin as it needs. It's the more common of the two main types. This video reviews therapies and lifestyle changes that can help reduce the effect of diabetes on a person's health. Is diabetes curable? While diabetes is incurable, a person can stay in remission for a long time. No cure for diabetes certainly exists, but the disease can go into remission. When diabetes goes into remission, it means that the body does not show any signs of diabetes, although the disease is technically still present. Doctors have not come to a final consequence on what exactly constitutes remission, but they all include A1C level below 6% as a significant factor. A1C level indicates a person's blood sugar level over 3 months. According to diabetes care, remission can take different forms. Partial remission, when a person has maintained a blood glucose level lower than that of a person with diabetes for at least 1 year without needing to use any diabetes medication. Complete remission, when the blood glucose level returns to normal level completely outside of the range of diabetes or pre-diabetes and stays there for at least 1 year without any medication. Prolonged remission, when complete remission lasts for at least 5 years. Even if a person maintains normal blood sugar level for 20 years, the doctor would still consider their diabetes to be in remission rather than cured. Achieving diabetes remission can be as simple as making changes to an exercise routine or diet. Managing type 1 diabetes. Type 1 diabetes is an autoimmune disease that often develops during childhood. It occurs when the body mistakenly attacks the beta cells of the pancreas, removing their ability to produce the insulin that the body needs to use blood sugar correctly. Receiving a diagnosis of type 1 diabetes can be daunting, yet many people manage the condition well, keeping symptoms and severe complications at bay. Insulin treatment. Insulin injection are the most common treatment for type 1 diabetes. People can self-administer these injections at home. There are a range of insulin injections available. They vary according to how quickly the insulin works and how long its effect lasts in the body. Insulin aim is to mimic how the body produces insulin throughout the day in relation to energy intake. Use of verapamil. A 2018 clinical trial on humans found that an existing blood pressure drug called verapamil may be helpful for people with diabetes. In the study, people with recent onset type 1 diabetes received doses of verapamil. The trial showed that their fasting glucose level ended up being lower than those who did not take the drug. For people with type 1 diabetes, these drugs seem to improve insulin production in the pancreas, reducing the need for regular insulin injection. However, the FDA has not yet approved verapamil as a treatment for diabetes, even though it has shown a lot of promise. Now I'll be talking about the implantable devices. Scientists have long been researching the use of implantable devices for managing type 1 diabetes without the need for regular injection. This 2016 animal study discusses an implantable device that could protect beta cell in the pancreas. Researchers found that the device protected a mouse pancreatic beta cell from immune attack for UP2 6 months. Managing type 2 diabetes. A healthful well-planned diabetes diet can help a person manage diabetes. Currently, it is easier for a person to reverse type 2 diabetes than type 1. This is because type 2 diabetes is not an autoimmune disease and a range of outside forces and lifestyle habit can make it worse. While this means type 2 diabetes is much more widespread than type 1 diabetes. It also means that a person with type 2 diabetes can make relatively simple lifestyle and dietary adjustment to bring their blood sugar level back into a normal range. Dietary intake, obesity both play a critical role in the development of type 2 diabetes. As such, people can reverse symptoms of type 2 diabetes by adhering to specific lifestyle changes that include improving their diet and exercise regime. Now I'll be talking about research into reversal method. A 2016 study found that certain intervention can help put type 2 diabetes into remission, including personalized exercise routine, strict diet, glucose controlling drug for a month after the intervention. 40% of the subjects were able to stop taking their medication and remained in the partial or complete remission. Managing gestational diabetes. Gestational diabetes is a type that develops during pregnancy and resolve after the birth of a child. Many diabetes medications adversely interact with the developing fetus, so speak to a doctor about pregnancy-safe alternative for reducing blood sugar and boosting insulin. People with gestational diabetes must control sugar intake and engage in regular light exercise. However, if this does not have the desired effect, the doctor may prescribe insulin to control blood sugar level. So that's all about the diabetes in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all, please do like, share, subscribe this video with your loved one so that they will get to know better. This is Carrie Anderson signing off. We will definitely meet in the next video with my another content. Till then, God bless you. Bye-bye and take care.